So let us discuss about this case. So use spot diagnosis.
It's a right hand of the patient, sir, lying dorsum of the hand lying flat on the table with a flexion deformity noted at the ring finger and little finger at the MCP joint, with a cord-like structure noted extending from the base of the ring finger onto the mid palm level.
Okay.
There are no scars, sir, seen. There is no sign symptoms of any burn injuries or previously burn wounds.
So what is the spot diagnosis?
It is a Dupuytren's contracture involving the fourth web space with ring and little finger.
Okay. Would you like to do any investigations to confirm your diagnosis? Or any investigations which would confirm your diagnosis?
I would like to take history, sir, detailed history. And Dupuytren's contracture is a clinical entity and the diagnosis is made clinically.
Okay.
I would like to perform few tests with.
No, that's okay. For your diagnosis, it
Yes,
is a
sir.
clinical diagnosis.
Yes,
You don't
yes.
need any investigations for your diagnosis.
Yes.
So what are the positive findings which you are seeing in this particular hand, in this extremity?
So there is a obvious cord which is seen, fibrous cord, possibly a fibrous cord which is seen at the base of the ring finger extending onto the mid palm level with attitude of flexion
Okay.
at
So
MCP joint.
what other findings are not seen in this patient, in this image, but you would like to examine the patient for, considering that this is a patient for Dupuytren's? I'll reframe my question. What other findings are there in the case of Dupuytren's
Yes.
which are not seen in this image and you would like to examine in the patient?
Yes. I would clinically like to feel the cord and the surrounding dermal tissue to evaluate for any presence of pits or any presence of nodules. Any subclinical nodule which cannot be clinically seen but can be clinically felt on palpation can suggest the progressive or the spreading nature of the disease.
Okay.
And could be caught in an early clinical stage.
What is not seen in this image?
I cannot see pits.
I mean to ask about the systemic involvement. What is not seen in the hand and what else would you like to see? I'll reframe my question. What are the systemic associations with Dupuytren's disease?
Systemic associations like chronic alcoholism, smoking, diabetes, and other history of epilepsy is also been associated.
Yeah.
So perhaps if tobacco consumption is there, I can look for nicotine stains or.
Okay, those are the systemic associations.
Yes.
What other manifestations are there across the body in case of Dupuytren's?
Across the since Dupuytren's is a entity which comes under the fibromatosis disorders, I would look for involvement at the dorsum of the hand overlying the MCP and PIP joints to have Garrod knuckles if there is presence of thickening.
Garrod's knuckles are there over the
PIP.
PIP joint,
PIP joint,
not the MCP joint.
Sir, yes, over the PIP joints. I would also look for thickening over the plantar region, which would suggest Lederhouse disease, and also examine his genital region to look for penile fibromatosis, which is also known as Peyronie's disease.
Okay. So looking at this image, what do you think is what might be the age of this patient? Depending upon the statistics of presentation of varied age groups.
Most commonly, males are affected around 10 to 15 times increased risk of contracting the disease or having the disease, and the age around 4 to 6 decades or fourth to fifth decade. So people of this range are more commonly
That is
found
the
to have
commonest age of
group of
presentation of Dupuytren's.
Sir.
So, in this image, as we are seeing, there is involvement of the ring finger, predominantly involvement of the ring finger, wherein the band is seen.
Yes.
So, what are the other types of presentations? When do nodules occur? How does the disease begin and progresses?
The disease begins with a formation of pits initially, or a nodule formation. Classically, it is described a nodule formation in which the vertical extensions of the palmar fascia are initially involved, which causes thickening and the retraction and the subsequent dimpling of the skin. This nodule and as the disease progresses, the nodule gets converted into a cord, a fibrous cord-like structure, and this subsequent cord, as the disease progresses, gets converted into an contracture.
Yeah. So pits are not the initial mode of presentation. Pits
Sir.
occur late when there is involvement of the skin, and then there is puckering, and then
Yes.
there are pits.
Yes.
So when this patient comes to you,
Yes.
how would you counsel the patient?
I would ask him about his family history, sir, about his habits, coexisting diseases, and let him know, because these are the risk factors for recurrent disease as well as earlier progression of faster progression of the disease. And I will let him know if these things, if these risk factors are present in him. Then I will let him know about the diagnosis, the clinical entity that he has, and explain him the various treatment modalities and subsequent prognostic.
Okay.
Prognosis.
So talking of risk modalities, what type of Dupuytren's is not a good type? The prognosis is bad in what type of Dupuytren's contracture?
Prognosis. The most commonly involved is the ulnar side of the hand. So when radial side of the hand gets involved, it is a risk factor.
Yeah.
When the progression history is of shorter duration, and and the patient who has a stronger family history.
Okay.
So these are the red signs which we have to initiate.
So rapid progression,
Rapid
radial involvement of digits,
Yes.
faster speed of
Yes, sir.
progression, and one of the more important things is
Stronger family history, along with that presence of ectopic sites,
yes.
including the plantar, the garrot knuckles, or the Peyronie's disease.
Anything else which you are missing?
Younger
age of onset.
Younger age of onset, yes.
Younger age of onset is probably one of the
Yes.
most important prognostic criteria. Younger
Yes.
age means bad type of
Bad.
disease. So in this case, what treatment options do we have at our disposal?
So in this particular case, the patient has an MCP flexion, which seems to be almost of around 30 degrees or so.
Okay.
So, so an intervention is required in this patient. I would surgical intervention.
Is 30-degree criteria for surgical intervention? When do we need to operate, or do we need to operate all cases of Dupuytren's, or are there any guidelines? When to
So
operate, when not to operate?
When the patient presents with complaints of inability to perform daily functions, so when it is causing an hindrance in his daily activities, can be considered a criteria.
Okay.
So I've come across data saying that a MCP flexion of 20 to 30 degree can be considered as a criteria for surgical intervention, and a PIP contracture of more than 20 degree, which is documented to be progressive in nature, has to be considered for surgical intervention.
Okay.